Hey everyone, my name is Dan Hearn. I am a substance abuse professional specializing in occupational health and safety. Today I'm here to talk to you about reasonable suspicion and the fit for duty process. This is a common reaction in the industry today. Nobody wants to deal with addiction in the workplace. It's an uncomfortable subject. Alcohol and drug policy goals. We want to improve workplace health and safety. We want to reduce workplace injuries and fatalities. We want to balance the employer's right to ensure a safe workplace with individual privacy. We want to protect the safety of the employees, the workplace, and the public. And we want to increase productivity, reduce liability, and protect profits. The definition of a safety-sensitive position. Any position where impairment could result in an incident affecting health, safety, property, or finances. It's based on actual job duties, not titles. It can include part-time employees. It can include managers and supervisors in direct supervision. It can cover a wide variety of industries, jobs, and employees. Employers have a duty to accommodate. They have to accommodate disabilities, including addiction disabilities, to the point of undue hardship. Policies should encourage self-disclosure. Employers have extensive safety obligations regarding fitness for duty, including ensuring employees report fit for duty and remain fit for duty throughout their shift. They have to train supervisors on reasonable suspicion and fit for duty processes. They have to accommodate disabilities, including substance abuse disorders. They have to have policies and processes that encourage self-disclosure. When can an employer drug test? They can drug test pre-employment, before you even get the job. They can do it pre-access. If you're going on to different job sites and stuff, they can require a drug test. Annually, as part of their policy. Post-incident or accident or near miss, you don't even actually have to get into an incident, you just have to almost get into an incident. Reasonable suspicion and fit for duty situations. Return to duty and follow-ups. Random tests can be part of your policy. It's easier to do in the States with their policies in the DOT. Canada's a little bit behind, but if you write it into your policy, it can be done. Determinations to conduct reasonable suspicion testing are based on observations of employee conduct, behavior, appearance, or body odor, based on a set of circumstances that indicate a reason to conduct an investigation or assessment of the employee's fitness for duty. A reasoned, objective conclusion drawn from objective observations of the individual. Requesting a drug and alcohol test can be justified as part of the fitness for duty when it is written in your policy. Safety overcomes privacy with reasonable suspicion. Summary of the supervisor's roles. Reasonable suspicion is not an accusation of addiction or dependency. Supervisors do not diagnose abuse, addiction, or dependency. Supervisors do not need to identify a specific drug. Identify the specific observations of the employee that are cause for concern. Be alert to changes in the employee's usual behavior and appearance. Discussions with the employee should remain focused on his or her behavior, appearance, and performance. Collaboration with HR or another supervisor is required. The reasonable suspicion process. Observation, identify a set of circumstances. Confirmation, utilize another supervisor to do so. Documentation, be specific, no hunches, just facts. Discussion, it's not personal, no judgment, matter of fact. Testing, transportation to a testing facility and then home must be provided by the employer. We can't send someone off driving on public roads if we suspect they're under the influence. If they get into an accident, the employer could very well be held liable. Documentation. Specific facts and observations. Prepare and sign within 24 hours, preferably within 2 hours. Document all conversations and employee responses. Be clear, concise, and specific. Remember, proper documentation shows due process and will decrease the chances of litigation, grievances, or negligence. Testing. Observations must be made just during, just before, or just after an employee performs a safety-sensitive function. A supervisor who determines reasonable suspicion is not permitted to conduct a test. Testing is done externally by a third party. That prevents conflict of interest and biases. Testing should be done within 2 hours following observation. We want an accurate measure of the substances in their blood at the time, or as close to the time of the incident as possible. If you can't do it, make sure you document why. DOT regulations stipulate that refusal and non-negative test results are processed the same as a positive test result. If a worker tests positive for drugs or fails an alcohol test, the worker must be immediately removed from all safety-sensitive functions. Not allowed to return to a safety-sensitive function until they have undergone an evaluation, they have completed any prescribed treatments. That could be anything from a 2-hour education session to a intensive inpatient treatment situation. They have to pass a return to duty urine test, and the worker is then subject to at least 6 follow-up tests in the next 12 months. There may be aftercare requirements. Some examples of tests. This is a urine test. There's 2 cups in here and some testing strips. So 1 cup is filled and tested on site at the testing facility, and the other one is sealed and sent to a laboratory for further examination. This is a 7-panel test. It will tell you on the spot 7 different substances, whether they test positive or not. And this is a swab test. They just swab your mouth and they'll know right away if you've had any substances in your system. This is the quickest one. This one is especially good for marijuana. Marijuana has a tendency to stay in your system for a long time, but with a saliva test, it will let the employer know if the employee has used within the last 8 to 10 hours. And a reassessment may occur at any time if warranted. Returning to work. Interview with the recovering worker is to be done with HR, and it's to be done immediately upon returning to work. The employer must provide information and discuss any change in work and responsibilities, like support, aftercare requirements. Discuss the policy and logistics for follow-up testing. This all falls under the right to know. You have to do these things. An offer of support, thus encouraging the worker to express concerns. We encourage you to use an open door policy. Allow the worker to comfortably voice their concerns with you, and whether or not they feel that the work plan can be modified to accommodate them. Returning to work can be very difficult. The first few months of recovery are very hard. They're not cured. They have only been stabilized, and they have to keep working on their recovery. Continued support is crucial even after the return to work is complete. Penalties. Criminal charges are possible for employees failing to ensure employees are fit for duty. The maximum fines in Saskatchewan can reach $2.1 million. And this isn't all OH&S legislation. I know the OH&S legislation's maximum fine is $1.5 million. This is criminal. It's different. Bonus questions. Do you have to prove what substances do you have to prove what substance has been used?
Absolutely not, no.
Do you have to diagnose addiction in order for a reasonable suspicion test?
No, leave that to the professionals.
Okay, do we have any questions?
No, makes sense to me.
Okay, thank you very much for your time. Here's my references. All right.